Hi, I'm Dr. Michael Denk. I trust you'll find the following seminar both interesting and educational. So this is a little bit about liposuction. This gal isn't happy with her legs fit, late 30s. I liposuction the front of her thighs, the side of her thigh, the saddlebag area, and the inner thigh. And that's a before and after straight away. Nice thing about thigh liposuction, usually you can hide the scars in a freckle or under the underwear line, so there's no visible scar. And that's her side view. And it just demonstrates just the tone. She certainly helped me post-operatively in terms of her workout, but again, just a thick, the thick, stubborn saddlebag or the inner thigh can be taken away. This gal's more of the same, a little younger gal, but again, anterior, front, lateral thigh, and inner thigh. And you can really see the saddlebag. You can see it really didn't change her buttock crease. But people ask all the time about cellulite. What can you do about cellulite? Cellulite really is from the fascial or fibrous attachments we all have from the muscle below to the skin above. And you can soften the effects of those fascial attachments. And they're really like partitions. And liposuction definitely breaks them up. No, we don't take the partition out, but you can see from her that even on her thigh and even on her lateral buttock, the cellulite look is gone. And it's one of the favorable side effects of trying to debulk a full area. Yes.
How much is that taken off?
How much fat did I remove?
Yeah.
It depends from patient to patient, and it depends on the area. The best liposuction candidates for this type of body contour of a thigh or even a stomach is somebody who's pretty fit, who has a stubborn area. Most women don't get, this word is a word that plastic surgeons use all the time, saddlebags. They don't get saddlebags, nor do they get flank fullness or waist fullness until they're pregnant, or because it's really fat store. You have to have a certain amount of fat store to make breast milk. And isolated fat stores or isolated areas of fat are the best types to treat. They're the best candidates for liposuction. So her thighs, her lateral thigh, outside thigh, I probably took maybe 200 cc's, maybe her inner side 300 or 400 cc's, maybe the front of her thigh 300 or 400. You certainly can take too much. A cc is a pound of fat is about 500 cc's. A Coke can is 12 ounces, and was it 233 or 244 cc's? I don't know if anybody has a can. So when I do liposuction, you put a solution in that's saline and epinephrine and local anesthetic. So you want to mainly remove just fat and minimize the bruising. But it's certainly an art as much as it is a science. You don't want to leave tracks. The smaller cannula, the smaller diameter of the cannula, the less chance you are of leaving divots or tracks. The larger bore, the larger diameter of the cannula, the less you have to work as a surgeon, easier it comes out, but the more likely you are to leave tracks behind. So you don't want to leave any irregularities, indents. So you want to be exact with what you take out. But the general lower extremity liposuction case is probably 1,000 out. Tummy and lower extremity maybe is 2,000. We did a case yesterday. We took out 3,000 cc's, upper back, upper tummy, lower tummy, and inner thighs, and her waist. And then I did a modified tummy tuck or mini tummy tuck, which isn't unusual.
What's the most you can take out?
The 5,000 cc's. 5,000 cc's is the most anybody in the United States can take out and go home as an outpatient. When I trained, it wasn't unusual when liposuction actually started here, actually in this building. Dick Malatic and my senior partner, Jonathan James, were one of the first two people in the States to do liposuction. At that time, it was a lot more blood loss, a lot more blood loss, a lot more dangerous. And when I was a resident in the early 90s, people would remove 6, 7, 8,000. The main issue with that is it's a traumatic event and dehydration. So about 10, 15 years ago, nationwide, there's a health regulation that says 5,000 cc's is an outpatient. And I've never done more than 5,000 cc's, and I probably would do 5,000 cc's maybe 3 times a year in a gal who's, you know, stubbornly and just frustrated overweight, and she knows it's not about shape. She knows it's about just trying to debulk and try to get some thinning somewhere, and that she knows she may come back for a second round of liposuction or maybe even a tummy tuck. It's all about, you know, people understanding what liposuction can do and can't do. It's a body contouring tool, and it's truly a tool, just like scissors is a tool. It's not a weight loss plan. Now, these gals lost weight, but you can see all of them look a little bit more fit. So one thing that cosmetic surgery is, it's gosh, I got to show my body to somebody. I got to make a commitment, and then I got to make a financial commitment, and then I've got to go through it. So it tends to be a big motivating force to get people to say, okay, you know, this is, you know, I got to do my part. And I stress that to my patients, that I can do my part, but you have to do your part. This gal, a little heavier thighs, she actually had liposuction, and then I removed some skin, so she had what's called an inner thigh lift. So she has a scar here. And it's probably one of my least favorite scars to put on someone, because no matter where you put it or how high you try to put it and hide it, it shows outside of most undergarments. But again, got the result she wanted. She not too concerned about the scar in terms of what she wears. This gal is pre-pregnancy, 30, complain about her waistline, love handles, upper tummy, lower tummy, and then her back. So just liposuction alone, no fat grafting at all. And we can see what it does for shape. So people often ask about, you know, how can I work out? How long am I out? From most of these procedures, you can do aerobic exercise, elliptical, heavy walking, some jogging, within a week, 10 days, even a breast augmentation, and even a BBL. Certainly 3 weeks you can do just about anything, but usually a week to 2 weeks, depending on the patient, is when they let them, you know, get back to full activity. Because we're talking about the beach and the sunshine, one thing that I always counsel my patients about is not getting sunburn on a surgical site for about 3 months. And so it's important to be mindful of that, especially in the breast augmentation patient, because you're obviously changing the angle of your chest, and it receives a little bit more sun than usual, so it's easy to burn that.
Are you talking about just where the scar is, or the
No, where the fullness is.
Okay.
That, you know, that was once relatively flat, now is, you know, protruding, so it's easy to catch that sun.
How about going in the pool or the ocean?
Typically 2-3 weeks. And if people are dying to go in the pool, I'll let them, you know, you can jump in the pool in 2 weeks and get out, if everything's going well. All the patients you've seen today and will see, they've all taken a shower fully naked with soap and water everywhere, just like you did this morning and I did 2 days after surgery.
So when you say you can't like pick up more than 10 pounds, can you like hold 10 pounds?
Yeah, like a
But you
baby?
just-
A baby?
Yeah, or like can't
Yeah,
physically
I mean,
pick it
the
up.
most unpredictable, the most troublesome thing about babies is that, you know, and it's one of the wonderful things about them too, they're unpredictable. So that the child who's 8 months or even 2.5 years, it's them throwing themselves at you or because of you.
Jumping on you.
Yeah. So I always say the best thing to do for that first couple, 3 weeks is have a blocking pillow. You know, have dad set the baby. You just got to be ready. You gotta be ready. I mean, I've had to redo somebody's nose because, you know, her son got a little too excited within a month of surgery. So, you know, a little, you know, it's the kid, I mean, where do kids want to be? I mean, if Matt and Christopher and Mark and I want to be on somebody's breast, certainly your child does.
Yeah.
So you have a little blocking. They knew where it was going. So the blocking pillow works, you know, 'cause, I mean, the kids
But
want
if
to be
like
there.
somebody wanted to like hand me,
Oh, gosh, yeah, even
Okay.
20-pound child.
and that's just so like the stitching won't like.
You know, people always worry that stitching gonna come loose.
Right,
All
is that why?
all the stitches in these operations, except for the ones down the midline and the tummy tuck, inside stitches, they're all dissolvable stitches. So it's not uncommon for a breast or even a tummy tuck to call and say, gosh, I think a stitch got loose. And it's okay, usually. But in terms of, you know, I encourage my breast augmentation patients to go out 3 nights afterwards, and some people go back to work. I've had people go back to work 4 or 5 days. I've had people run a 5K, you know, 6 days after a tummy tuck, and definitely 6 days after a augment. And it's not for everybody. I mean, everybody's different.